Okay, guys, I know that some of you might think that I can often be pretty down on America, or maybe that I lack the requisite patriotic fervor. But today, I'm here to say, without any reservation, that America's healthcare system is #1 in the world in maternal death rates and infant mortality and deaths from avoidable or treatable illnesses, and COVID deaths, chronic health conditions, and healthcare spending. So cue the Lee Greenwood.
That I'm proud to be an American.
True story. Once I got kicked out of a bar for putting Proud to be an American by Lee Greenwood on the jukebox like 10 times in a row. I put in $20 and just kept pressing it. I thought it was funny, but no one else thought it was funny. That could be the name of my autobiography. But no one else thought it was funny. The Michael Burns story. Okay, so as you likely know, my home nation is the only high-income country in the world without some form of universal health care. And before you type in the comments, Obama, the Affordable Care Act doesn't count. Now, for most of you, this is of course not a newsflash. Anyone who's ever had to go to the emergency room knows that even basic services like x-rays, IVs, even Band-Aids, Advil, and hell, a bottle of Pedialyte can send you home with a bill running between hundreds and thousands of dollars. And that's after insurance. True story. So I had to get IV fluids in urgent care the night my daughter was born. Obviously, it was really hard for me, a man, to watch someone give birth. But with insurance, I had to pay over $300 for that. And I have like the good insurance plan. For a lot of us, anything besides an annual checkup is so expensive, it might seem wiser just to wait it out, which might be good financial planning because you can't keep racking up healthcare bills if you're dead. So what happened here? How can healthcare in the US be so much more expensive and health outcomes so much worse? Why are we stuck choosing between life-saving medical treatment and bankruptcy? And is there any way to fix this before the American life expectancy drops to that of a medieval peasant?
Bring out your dead! Bring out your dead!
Let's find out in today's video on America's healthcare system, how we got here. Okay, so to understand why it costs you $380 to get your earwax removed, let's look at the history. Now, medicine in the West stagnated for centuries after the initial innovations of the ancient Greeks. As late as 1850, American doctors, most of whom lacked formal medical education, had at best approximately the same knowledge as 2nd century Greek physicians. But as the germ theory of disease gained traction, medical science started innovating. Hospitals popped up all over to sequester people stricken with infectious diseases, though they were honestly far better at spreading disease amongst the patients, at least until antiseptic practices improved in the 19th century. While doctors typically couldn't cure diseases, preventative medical advancements like vaccines, the ability to combat vitamin deficiencies in babies, and the advent of milk pasteurization cut the death rate for American children. Life expectancy began a meteoric rise. Around 1930, new drugs started popping up for everything from treating diabetes to curing infections, and medicine entered an era of exponential innovation that continues today. In fact, in 1950, more than 90% of the medicine practice today didn't even exist. But as we got way better at not dying, we also faced a problem. How do we pay for the pleasure of sticking around? Because pricey and innovative treatments were adding up fast. Back in 1930, Americans spent $23 per person on healthcare, which is 3.5% of GDP. By 2022, that number was over $12,500, more than 17% of GDP. Now, adjusted for inflation, medical costs rose by a factor of 30 over the past 90 years. I don't understand how math works, but this seems bad. Now, a lot of this was due to new treatments, while some was simply the result of our growing and aging population. But a significant chunk was inflation within the medical industry itself. Indeed, until the outlier year of 2022, when eggs cost their damn weight in gold, rising medical costs had outpaced inflation for 4 decades. This is important, as history writer John Steele Gordon explains. Whenever one segment of an economy exhibits year after year inflation above the general rate, and when there is no constraint on supply, then either a cartel is in operation or there is a lack of price transparency, or both, as is the case with American medical care. Now, to understand why it's fair to call Mount Sinai Hospital a cartel, let's flash back to 1929, just as innovation was about to kick off. Now, hospitals faced a glaring issue. They were super expensive to run, and cost remained pretty stable regardless of how many beds were full. So in 1929, a hospital in Dallas, Texas, introduced the Baylor Plan, the first ever hospital insurance. 1,500 school teachers each paid $6 a year in premiums and were guaranteed up to 21 days of hospital care. This wholesome plan totally worked out. The hospitals could keep the lights on regardless of how many patients they had, and school teachers didn't have to grapple with huge costs if they got sick. Many hospitals followed suit, eventually building insurance plans for networks of hospitals like the nascent Blue Cross Blue Shield. But there's a key difference between these hospital insurance plans and the ones we know and hate today. They were directly implemented by the hospitals, which meant that they paid all costs for your stay up to a certain limit. But as new expensive treatments started keeping patients alive longer, insurance companies began providing supplementary plans in the 1950s. As money increasingly stopped going into hospital coffers and started passing through the grubby hands of your middleman insurance agencies, things were gonna get gnarly. Unless you think that I'm just waxing poetic here, know that hospital insurance was hardly perfect. For one, because they only covered hospital care, you had a lot of people that were scarfing down Jell-O and overnight wards while receiving treatments that should have been outpatient. Secondly, this coverage didn't deal in indemnification, like other forms of insurance, which means that it didn't pay you to deal with your medical issue as you saw fit. It simply paid the hospital bill. Now, you don't have to be Milton Friedman to conclude that, as writer John Steele Gordon notes, with someone else paying, patients quickly became relatively indifferent to the cost of medical care. Now, doctors and hospitals were understandably pretty stoked on a system that gave them carte blanche to charge whatever they wanted, and they lobbied hard to stave off regulation. Blue Cross's hospital insurance and Blue Shield's physicians insurance took over the market. Thus, upstart insurance agencies had to imitate their generous model. As Gordon explains, hospitals came to be paid almost always on a cost-plus basis, receiving the cost of the services provided plus a percentage to cover the cost of invested capital. Any incentive for hospitals to be efficient and reduce costs vanished. Now, after World War II, companies wooing prospective employees started offering health insurance, and unions fought hard to make them broadly accessible. But there was a problem. With employers covering the cost of insurance, there wasn't much incentive for employees to pick the most cost-effective plans. Another problem was that insurance companies cherry-picked which businesses they'd offer insurance, prioritizing larger companies with healthy workforces. Now, this drove up costs for everyone else. Then in the 60s, the government rolled out Medicaid for poor folks and Medicare for elderly ones, which were structured similarly to private insurance, just that Uncle Sam footed the bill, USA. This was a bonanza for healthcare providers, as whole new swaths of the population were able to afford their inflated costs, and medical professional salaries nearly doubled over the decade. Now, in the years since, medical innovation has cut down dramatically on hospital stays, but the same new technology makes hospitals more expensive than ever to run. Yet, because of the enduring cost-plus system, hospitals don't have to compete to attract patients by having the best price or by specializing. Instead, they rely on doctor referrals, which means having the most experienced, i.e., priciest doctors, the fanciest equipment, and enough empty beds to ensure immediate admission.
I'll just remember that it's the opposite of what they say.
I'd really be more comfortable if you rewrote the form.
No, I'll remember. Opposite, opposite, opposite.
As Gordon concludes, the inevitable result, of course, is that hospital costs have skyrocketed. At the same time, doctors have, since the passing of the Social Security Act of 1965, been paid according to a standard of usual, reasonable, and customary charges. Gordon explains that doctors could bill whatever they wanted to as long as other doctors were charging roughly the same. The incentive to tack a few dollars onto the fee became strong. The incentive to take a few dollars off in order to increase market share ceased to exist. Basically, if everybody collectively charged inflated prices, the inflated price became the new normal, and there was really no reason not to do just that. Meanwhile, the ballooning cost of medical malpractice suits were also getting passed back on to patients and insurers. Prices just kept going up.
You left a pair of scissors inside of my wife?
Yes, that's correct.
Timothy Faust, author of Health Justice Now, summarizes, healthcare costs are high because healthcare prices are totally made up. He cites the example of MRIs, which despite being the same cost to provide anywhere, vary widely in price depending on factors like, which doctor is nearest to the machine. He concludes that there is no relationship between the cost to provide care and the prices charged for them across and even within hospital facilities. The whole thing is totally made up. Guys, the thing that ruins people's lives is just made up. Now, for many people, America's healthcare system isn't really a day-to-day concern. Since the Affordable Care Act added 20 million Americans to the ranks of the insured, health insurance basically works for people who are healthy. Insurance costs are reasonable and wellness checks are covered. But let's say, I don't know, you're sick or disabled or struggling with mental illness. If you actually need healthcare beyond an annual checkup, well, hey, it's a different story and not a good one. Because according to a 2017 study published in Pain Physician, the ACA functionally ensures we all have the right to affordable health insurance, but not necessarily to affordable health care. Crucial difference. Insurance doesn't do a lot of good if you can't actually use it. The study found that in the years since the ACA was implemented, actual access to health services has diminished, particularly for low-income folks and Black and Latino people with chronic illnesses. Even folks with employer-sponsored insurance are seeking less care. Cost-prohibitive deductibles, co-pays, referrals, and prescriptions, as well as the difficulty of finding in-network providers and timely appointments make using those benefits a pipe dream. Now, guys, I don't have the numbers in front of me, but I have insurance through work, and it's like a really good plan. I think they take like $800 a month from my paycheck for the insurance. And then I probably in a given year have to pay close to $2,000 to $3,000 out of pocket for doctors and stuff that aren't covered. So I have insurance, and I don't know, you could do the math on that, like $800 a month, a few $1,000s a year. It's a lot of money, guys. I could be buying merch, guitar gear, snacks, flip-flops, themed Crocs, new underwear, so many things with that money. But instead it goes to me just like being a reasonably healthy person. Today, 1 in 3 GoFundMes are raising money for medical bills. And now the media likes to talk about this like they're feel-good stories of communities protecting their own. But that belies the really dark reality because only 12% reach their goals. 16% get no donations at all. Guys, this is clearly not a viable substitute for health insurance, and today, 62% of American bankruptcies are due to medical bills. It's really upsetting. I don't know how patriotic I am anymore. I think I changed my mind from what I said earlier in the video. I'm skeptical about this whole America thing. According to Allison Ciso, director of the charity RIP Medical Debt, the problem is that the U.S. healthcare system is a tug-of-war between hospitals trying to get paid and insurance companies trying to pay them as little as possible. Now, hospital costs are intentionally inflated for the negotiation process with the insurance companies, and private insurers can only negotiate down so far depending on how much market power they have. What's more, insurers don't have that much incentive to put a ton of effort into negotiating in the first place. They can simply pass any price increases back onto the consumer. Indeed, even when dominant insurers are able to negotiate prices down, well, hey kids, they just pocket the surplus rather than passing the savings back to patients. Because healthcare is a for-profit thing where people are making money in the market and on executive boards because we get sick. That's how it works, guys. I know that sometimes you're like, oh, it's woke crack now or whatever. And listen, I get it. We don't all have to be Marxist or anarchist or sort of democratic socialist or whatever. I totally get it. But can we all agree? Can we all just agree that it's maybe bad to have a system where people make money off of us getting sick, where it's beneficial for us to get sick and they will make surplus profit off our illness? Let me just think about it for a second and let me know down there. What's more, private insurers will try to pressure healthcare providers not to offer their competitors discounts, which artificially inflates prices across the board. I know this is all a little bit wonky, but here's the gist. If the system is a tug of war, insurers are often barely given the rope a real yank, which is why we say, just yank the rope. Meanwhile, massive consolidation of hospital networks is giving them more muscle power and destroying competition, which makes the negotiation process a lost cause for insurers. Now, the government has ways to eke out reasonable Medicare and Medicaid prices. But in turn, hospitals will often cite low earnings from those programs as the reason private insurers are charged so much more, an average of 207% of Medicare prices. But the data doesn't bear that out. And Whaley concludes that there's actually no relationship between a hospital's share of patients that are on Medicare and Medicaid and the hospital's prices. Meanwhile, hospitals also use their bargaining power to do things like make insurers promise not to steer patients to lower cost hospitals. And some major hospital networks effectively act as a tax on everyone with private health insurance. And this tax is spread equally across demographics. As Duke University law professor Barack Richmond puts it, family that is earning $40,000 is paying the same in premiums as a family that's earning $4 million. What's more, like always, young people are the most continuously f***ed by the whole debacle. And it's like they're a part of a human centipede of healthcare cost-induced pain. If you have not watched the movie The Human Centipede,
We start with cutting the ligaments of the kneecap.
please never watch it. As Kofi Ampabeng and Elise Amez-Droz wrote in Fortune, today the rule is simple. Elderly reap more in benefits than they paid into the system. The current young generation stands to pay more than they'll one day receive. Because young folks are less likely to have employer-based health insurance, they usually have to pay for their own, which typically costs more than all health services they'll use in a given year, not even counting deductibles and co-pays. It's a shit sandwich garnished with more shit dipped into a little cup of warm pee. Meanwhile, the healthcare industry is working hard to keep things this way, spending more than any other industry on federal lobbying. This led medical journal, JAMA Internal Medicine, argued that the industry wields a disproportionate influence over health policy decisions. Collectively, they shelled out $714 million in 2020 alone, a leap of 70% since 2000, largely in response to the ACA. Right behind them, the second highest spenders are the insurance industry, of which health insurance is the leading sector. They do super fun and chill things like aggressively opposing legislation that would have cracked down on insurers' frequent rejections of mental health and addiction treatment claims. Guys, I cannot tell you how many times I've submitted like therapy or psychiatry stuff to the insurance and they're like, no way. Why would we pay for this? You're getting a legitimate medical service for a condition that you have. Why would we pay for that? Mr. Blue Shield, if you're watching, shame on you. One salient example came in 2020, when Washington State tried to prevent health insurers raking in enormous profits from hiking prices for consumers. According to one representative, the state's top 3 insurers helped write an amendment that successfully weakened the bill. Bottom line, there's just an unhinged amount of money flowing into federal and state governments to encourage policy decisions favorable to folks profiting off the current system. And unsurprisingly, there's no equivalent lobby for patients. But it doesn't have to be like this. I know often in videos, we just leave you with like, everything sucks, deal with it. But this one, we have clear examples for better systems. For example, you can just look to any other wealthy, industrialized nation, and plenty of not so wealthy ones too. Consider this clip from Michael Moore's 2007 film Sicko, in which a Canadian man who injured himself golfing in Florida quickly flew back home for some free surgery.
Where medical matters are concerned, it wouldn't matter in Canada what party you were affiliated with.
Now, obviously, Canada and Great Britain's healthcare systems are struggling and becoming increasingly politicized. But their systems still operate under the basic expectation that membership in a society comes with some amount of protection. That's not a rare concept worldwide either. 72 countries have some form of universal healthcare. If you're from one of those countries, let us know in the comments and let us know what that's like, because we have no idea. South Korea's government covers up to 60% of all medical expenses, which many supplement with private insurance. Brazil, for its part, offers free healthcare to anyone within its borders, regardless of citizenship. What's more, these countries are typically spending much more of their money on preventative care. That is, they're treating people before they've developed expensive chronic conditions, which is more cost effective and also, nice for people. With these alternatives, it's no wonder that Americans are just jonesing for universal healthcare. 64% of Pew survey respondents agreed that it's the government's responsibility to ensure healthcare access, whether through a single payer or mixed system. Unsurprisingly, young people are the most gung-ho about this. Now, amongst the proposed solutions is Medicare for All, which would create a system where the government, rather than our lethargic private insurers, would negotiate healthcare costs for all of us. Now, the expansion of Medicaid under the ACA is arguably its best legacy, so it's no wonder that this seems appealing. And just this week, several big pharma companies agreed to start negotiating maximum drug costs with Medicare for the first time in accordance with the Inflation Reduction Act, making crucial medications affordable to those who qualify. Healthcare providers, however, worry that expanding Medicare to everyone would be disastrous for healthcare facilities, who would no longer be able to aggressively overcharge privately insured folks. But of course, it would be a literal lifesaver for the millions of uninsured and underinsured Americans, as well as those of us who have insurance, but honestly just can't really afford to use it. Now, other rich countries around the world are spending half of what we do per capita on healthcare and seeing much better outcomes, proving that these systems save money and lives. And I think lives are probably more important, but it's good to save both. Those who defend America's current system of healthcare often cite the importance of market competition in keeping any industry's prices in check. But as we've seen, healthcare and health insurance simply don't work like most industries. And when we try to make it, we end up with a cartel-like system that makes breaking an arm or a leg basically cost you an arm and a leg. The business of saving people's lives is simply too important to be left to market forces. Now, obviously, overhauling America's healthcare system would not be easy. But when you consider just how young our system is, remember the first insured teachers ponied up 50 cents a month less than 100 years ago, it starts seeming a little ridiculous that we would hold so tight to a model that's so blatantly flawed. But what do you think about all this? Is America's pricey and ineffective healthcare system just inevitable? Is radical change possible? Or is our ability to get colonoscopies always going to be at the mercy of the market? Please let me know in the comments what you think. A huge shout out to all of our patrons who support us directly. They really help us not play into the market forces of like algorithms and ads because they just give us money, which we really appreciate. They get our videos early with no ads, extra audio and video content. They get on our Discord server, all sorts of goodies. If you have government provided health insurance and have some extra money to spend, consider signing up for our Patreon. There's a link in the description, or you can go to patreon.com/Wisecrack. Now, if you are a fellow American with so many healthcare bills you can't even imagine being on Patreon, I get it. So thanks for being here, for supporting our channel, for hanging out during videos like this that can be bummer trips, for leaving comments, for clicking all types of notifications. It really does mean a lot to us, and it literally helps a small team of us stay insured. So thank you for that. In the meantime, I don't know, stay healthy and get plane tickets to Brazil when you're sick, and I'll see you later.